kind of present this in three sections of parts, if you have them. So first, we're going to go over things, and we want to make sure we understand certain terms and terminologies. We want you guys to understand who we are, what we do, and then number two, we want to talk about certain ailments and diseases, certain eye problems, and the more common ones. I mean, there are thousands of eye ailments, but we're going to touch on the more common ones, and after that, then we'll have like an open question and answer session, because I'm sure you all will think of a lot of things that we may not have covered. So I want, to provide that opportunity, if you can, to get your questions out. So I got a question. Who knows what an optometrist is versus an ophthalmologist? Does anybody know the difference?
The optometrist is able to treat the eye, some of them examine the eye.
Well, close.
Close.
Yeah. Let's see what you have to say.
The ophthalmologist is the black sheep. Another the optometrist can fix your section for glasses.
That's pretty accurate. That's pretty accurate. So hopefully we can clear some things up. I mean, you've got maybe 4 key eye professionals. You have ophthalmologists, which is what I am. We have optometrists. We have opticians. And we have orthodontists.
What's optician?
Well, I'm going to get to that. So everybody's different. I'm glad you asked. So an optician is a professional who mainly makes glasses. So they don't do any diagnosis. They don't treat any conditions. But they have, I guess, in their area of expertise, it's mainly of mainly of designing and making glasses. Now, an optometrist is a professional. They have trained on an average of 5 years more over beyond college in a lot of cases. Now, what they mainly do, they treat minor eye conditions. So they can treat things like dry eye, pink eye, but that's typically the extent of what they do. They're primarily concerned about improving your vision. And that's normally done a couple of ways, with eyeglasses and or contacts. So their emphasis is on that. Now, you have some optometrists who specialize in what we call low vision therapy. You have some people who are legally blind or who have lost a significant amount of vision, but those optometrists have done additional training to help people adapt to their environments. A lot of times you can't really help them see better, but you can help them adjust and adapt to their environments. They're the ones who can tell you about certain instruments or accessories or tools you can use to get around better in your home, to function better, and to be safe. So those are low vision specialists, and most of them are optometrists. An orthodontist is a professional who mainly works on eye misalignments. So what's a misalignment? And a misalignment is when your eyes are not coordinated, they're not in sync together. So different conditions can cause your eyes to not be in sync. One can turn in, one can turn out. And depending on the degree of that, if it's not too severe, there are certain exercises you can do to try to bring your eyes into sync and into alignment. And, you know, there are different conditions that can contribute to that. A lot of them are congenital. A lot of people are born that way, with an eye turned in or eye turned out. Sometimes it can happen due to trauma. It can happen due to like a stroke or Bell's palsy. So there's several conditions that can do that. But what the orthoptist does, they try to get your eyes to work in sync. Now what I do and who I am, I'm an ophthalmologist, I'm a medical doctor. So after college, I went to medical school, which was 4 years. And when I finished, I got an MD degree, so I'm a medical doctor. Then, in addition to that, I did 4 years more of training just in ophthalmology, which is eye medicine and eye surgery. So I primarily treat eye conditions, eye diseases, and do surgery. Now, I still know to write an eyeglass prescription if I need to do that. But the way my practice is configured, we don't really have to make glasses. But the arrangement, everything is different with respect to each community. You have some communities where the optometrists and ophthalmologists work together, really big practices, and you kind of see that more and more in larger cities. And in our case, we have a fair number of optometrists. They have a significant amount of glasses and contacts. They do really well in that area. So our relationship is such that we will refer patients to them to get glasses, but they refer patients to us for surgery. And that relationship is okay. It's not an illegal relationship because there's no, money being exchanged under the table or anything like that. And the billing is done per the insurances, so it's all legitimate. Now, within ophthalmology, now you have subspecialists. You have certain doctors who have done, in addition to that 4 years of training, 1 to 2 more years of training in certain areas of the eye. So as small as the eye is, it has enough territory where you can focus even more on certain areas. We have retinal specialists, and the retina is the area of your eye. It's the back part of your eye. I don't know if you all can see this, but where you have the blood vessels back here, this orange part is called the retina. There's an area in the middle of the retina that's responsible for maybe 90% plus of your vision called the macula. That area is where everything is focused. That's where your fine vision comes from. So we have doctors who work mainly in those areas. So if somebody has a detachment, somebody has a bleed, you can get a stroke in your eye, macular degeneration, some people need injections or shots. The retina specialists are the eye specialists who work back there. We have other specialists, corneal specialists. The cornea, this part of your eye that looks like the little window of your eye, this is your cornea. Well, we have certain ophthalmologists who've done additional training in working on the cornea, and they primarily focus on this area. Some people may have scars on the cornea, or you have certain congenital conditions where you don't see well, keratoconus, things like that. They're the ones who do the corneal transplants. So the corneal specialist is one other specialist. Then we have glaucoma specialists. Well, we're going to talk about that in a second, but glaucoma, we're going to talk about the disease in a second, but glaucoma is a disease that affects the nerve in your eye. This nerve connects your eyeball to your brain. Your eye is the only part of your brain that you can see. Thank goodness. But when the nerve comes out back here, it's pretty fragile. And when you have damage back here due to glaucoma, you have certain doctors who treat certain areas of the eye to protect this nerve. And then we have doctors who work with the muscles. Believe it or not, you have 6 key muscles attached to your eyes. They're kind of like stirrups. Those muscles are moving your eyes in different directions, keeping you to see. And you can have an injury or it could be nerve damage to one of those muscles. So we have certain doctors who work on these muscles to keep your eyes aligned. And a lot of times they'll work with the orthotics. After a person gets muscle surgery, then sometimes they'll need additional training of those muscles. It's basically a type of rehab. They'll need a training of those kind of muscles to become more coordinated with each other. We have doctors who work primarily with children. A kid's eye hasn't fully formed, so it behaves much differently than an adult's. So we have certain ophthalmologists who only work with little kids. We have a few more. The plastic surgeons is called oculoplastics. The plastic surgeons of ophthalmology, they primarily work around your eyelids, your tear ducts, things of that nature. So they're used to working with a scaffold around your eyes to make sure that those tissues, you know, the bones support your eyes. If somebody is in a car wreck, they get an orbital fracture, a fight or whatever, normally an oculoplastic specialist will take care of them. And then we have neuro-ophthalmologists, ophthalmologists who mainly work with the nerves that control your eyes. A lot of people don't know that the center behind your head, at the back of your head, in the back of your brain, that center